Uh, Hey there, I'm Dr. Jolene Brighten, and in this video, we are talking about the correlation between hormonal birth control, depression, anxiety, how your natural hormones impact your mood, and what to do about it. We're rolling through Beyond the Pill, chapter 9, which is Take Back and really take charge of your mood, of your anxiety. Get rid of those mood swings, get rid of that depression, and what you can do about it. So, we're going to kick this off as we have been in our virtual book club, going through chapter by chapter. So, we are going to go through the chapter. I'm going to give you the highlights of what's going on in this section of the book, and then we're going to be answering questions live. Thank you all for being here. And please, right now, if you have a friend that could use this information to understand how to take charge of her mood, what is up with her hormones and her mood, is it maybe birth control? Please tag her right now. And that way we can support as many women as possible. Now, one thing I really want to kick this off with is in this chapter section of Beyond the Pill. So every chapter of the book, we dive in right away and we talk about high level what's in this chapter, like how the pill can make you feel depressed, the two primary risk factors for developing depression while on the pill, how the pill interferes with your serotonin production. Oh, yeah, we're going to chat about that. The connection between anxiety, your hormones, and synthetic hormones like found in contraceptives, how the pill causes nutrient deficiencies, and what to do about that as well. So, the first question I ask you in this chapter is: did your mood tank after you began birth control? A lot of my patients have experienced changes in their mood. So, having anxiety, having depression, having mood swings, having just like losing their edge, feeling like they're just not as vibrant as they used to be. So, it's not uncommon to see that women have mood changes with hormonal birth control. And as I kick this off, saying, we are not at a place in the research to say the pill causes, okay? We can't say hormonal birth control causes, although you guys can definitely say that because you probably had that experience. But where we're at in the research is a correlation. So we're going to talk a little bit more about hormonal birth control and what it's actually correlated with when it comes to the mood. And I also want to point out that these mood symptoms, they live in the package insert of these contraceptives. So all the hormonal contraceptives have, mood as a possible side effect of these in the package insert. And our sisters who went before us have complained about hormonal birth control tanking their moods since this pill was introduced. So that was my first question. And I tell a story about Samantha, who, when it was all said and done, felt like maybe these symptoms are all in my head. Maybe my doctor's right. Maybe it has nothing to do with birth control. And I bet a lot of you have been there as well. Now, I talk about the increased risk of suicide. It's very, very important to understand. We're not just talking about like, oh, I cry a little bit more when I'm on birth control, which is some doctors dismiss it that way. But there's actually a correlation with increased suicide risk. So let me run some stats here. And, I'd love to see emojis when I'm going through this. You can drop me some emojis on Instagram. What is your reaction when you hear this? So, women taking combination pills. So, that is the one that's most commonly prescribed, combination estrogen and progestin. If you're taking that combination hormone pill, these women in this study that was over 1 million women they looked at were 23% more likely to be prescribed an antidepressant. 23% using the mini pill. Women taking the progestin only pill were 34% more likely to be prescribed an antidepressant. So this is what I was talking about, that like we always thought it was the estrogen that was messing with our brain, that synthetic estrogen. And I see the like mind blown emojis coming through and the grinning faces and all of that. Appreciate that, you guys. So, but as it turns out, the progestin is messing with our brain. In fact, progestin alters the structure of the female brain. We can do a brain scan and see that structurally your brain looks different. Now, teens were 80% more likely to develop depression while taking the combination pill. 80%. If you were a teenager, 80% more likely. And teens who took the progestin only pill saw a twofold increased risk in their risk of depression. So that increased. Young women who use hormonal contraceptives have 3 times the risk of suicide. Let that sink in for a second. I would never advocate that we take away hormonal birth control. I would never advocate that we don't give women access to birth control, but I 100% advocate that they get the full story. And that if you're going to pass a young woman, a teenage gal, the pill or the patch or the ring or any of these things, that as a provider, you follow up with her and that like you let her know she can be at an increased risk of suicide. That if she can't tell her parents, tell her best friend, hey, my bestie, I'm going to start this pill. If I stop responding to your text, if I don't play with you, like I don't go out to play, I don't play with you. That's what I think. Like I don't go out with my girlfriends and play and like have a good time. And I start dropping out of society, dropping out of life. Please, like get me help, get me to someone because that could be early signs that my mood's tanking and that I'm at risk for suicide. There are ways that we can keep women safe. It's not an all or nothing here when we talk about birth control, but we have to know this. We have to be informed. Teens have double the risk of suicide after 1 year on the pill. So it doesn't necessarily get better just because you stay on it. They're 30% higher risk after 7 years on hormonal birth control of, actually committing suicide. We have to be having this conversation. We've lost too many sisters because we don't talk about these things, or because our doctor's not informed about these things, or because we get the narrative that birth control is a woman's right. So how dare we ever question anything about it? It's not either or. We can question the things and we can also have access to these things. But if we're not informed, then we don't know how to choose better and do better. You're still watching Broken Brain episode 6. Yes, I was in the Broken Brain documentary talking about the importance of our sex hormones on our brain health. And it is something that I'm very, very passionate about because we as women have been treated as if we're the same as men for far too long in medicine and research. And as it turns out, surprise, spoiler, we're not like men. And our brains are different as well. And our brains work differently and they respond to hormones differently. And nobody is better because of it. Okay. It's not that women are better or men are better. It is just a difference. And we have to acknowledge the differences. Now, the suicide risk of being on hormonal birth control peaks around 2 months after beginning. So if you have a friend who starts hormonal birth control, stay in touch with her, especially in those first 2 months, because that's when that suicide risk is going to peak. So I go through them beyond the pill. Are you at risk? How do you know if you're at risk? Well, two things we know for sure. A personal or family history of depression, even if that's your mama had postpartum depression, puts you at an increased risk, as does a family history of immune dysregulatory diseases and inflammatory diseases like autoimmune disease. Let me know on Instagram right now. Do you have an autoimmune disease? Because I have an autoimmune disease. And the majority of people who have autoimmunity are women. And so we get put on hormonal birth control. And as I talked about in the gut check chapter, that can be a trigger for developing autoimmune disease. And I just told you that autoimmune disease can be a risk factor for developing depression, anxiety, or mood swings. Like, do you see the connections that we can make here? We don't have to wait on science to have a perfectly developed study to start to think things through and start to do better in women's medicine. Now, I still want those studies. So please, if you are a scientist watching this, please do the studies because I love me some science and some research to back all of this up. But this is just to say that, like, we don't have to feel like we're crazy or like symptoms are in our head or like we're the only one who ever experienced this and feel isolated. Yes, I personally have Hashimoto's as well. I see Hashimoto's coming through. That's the most common autoimmune disease for women to have. And Hashimoto's hypothyroidism can present as period problems, and it can be a reason why we get put on hormonal birth control. So, how can the pill contribute to depression? This is something that I went deep into the research and really formed a hypothesis around this. And so, I want to say this. I'm going to put the book down. I'm going to explain this here for a second. So, there's really two leading theories of depression. There's the serotonin deficiency theory, which is that you don't have enough serotonin, therefore you're depressed. Then there's the cytokine theory of depression. That is, you have inflammation and the inflammation disrupts how your brain works. And that is why you're depressed. And there's nothing to say that, one is right or wrong. You could actually have both going on, but understand that excess serotonin is associated with adverse mood changes. So it's not that the answer here isn't just like raise serotonin, but let me explain this to you. Hormonal birth control depletes nutrients you need to synthesize your tryptophan into serotonin. If you subscribe to the serotonin theory of depression, then you can understand that if you have no nutrients to make your serotonin, then you could be more depressed. Now, if you subscribe to the cytokine theory of depression, then you can understand that hormonal birth control is inflammatory. They've done research, test a woman's blood, put her on the pill. What do we find? Inflammatory proteins are up and elevated. Now, the other thing is that when that giant study came out over 1 million women showing a correlation and a strong correlation between hormonal birth control and new onset depression and suicide in teens, doctors and researchers lined up to say it's correlation, not causation. And like there is no real evidence that hormonal birth control actually causes, depression. And yeah, we can't say cause, but what these people who were lining up to dismiss women's stories neglected to do was actually look in the research, where there was a study that showed that the tryptophan pathway is altered when a woman is on hormonal birth control. It actually marries the serotonin and cytokine theories of depression, in that while you're on hormonal birth control, you actually make neurotoxins. Let that sink in. You're taking hormonal birth control and you're actually making toxins within your brain. In addition, as you're going to catch me talking about in the Broken Brain series, so that documentary, I talk about how progesterone and estrogen can help modulate your immune system in your brain. But progestin may, in fact, increase free radical species by aggravating the immune system. So all of this can cause problems with brain function. When a doctor tells you your symptoms are just in your head, well, guess what? Your brain's in your head, but you got it wrong, doctor, because my gut is not in my head. And we understand that gut health equals brain health. And if you have a medication that's disrupting your microbiome, like the pill, then we could certainly see that you're developing mood symptoms. And there is lots of research showing the correlation between what is going on in your gut and what is going on with your mood. So I take you through brain supporting nutrients. Now, one thing I'm going to call myself out right here, because I know it feels a little bit confusing, is they do say coffee is a brain supporting nutrient, but then I tell you have to take it out in the Brighten protocol. The reason for that is, while coffee, yes, I mean, go check out Dr. Brednison, who's reversing Alzheimer's disease, Dr. Perlmutter, who is a neurologist. They use coffee with cognitive decline. So brains declining, they'll actually use coffee in their protocols. Now, with that, they're using coffee, but does that mean that like everyone is going to do well with coffee? Not necessarily. So it's all about what is true for you. And we've got to test that out. Like, is coffee really the best thing for you? And that's what you do in the Brighten protocol, is you actually test out if coffee is working for you or not. Instagram, I'm sorry. I see that it's glitching and it keeps saying that like I have poor connectivity. I just turned off the Wi-Fi and I'm hoping that helps. Sorry, guys. I don't mean to be glitching on you. The Instagram has been super, super glitchy. I couldn't even get on live this morning. I planned to go live at 8 a.m. and here we are now. That made it happen. Done's better than perfect, y'all. So I take you through brain supporting nutrients, things that you can do to nourish your brain right now if you're on birth control or off of it. I talk about never dismiss your risk or your symptoms. Never, ever, 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 ever let a doctor dismiss you or tell you your symptoms are not real. How can you advocate for yourself best? Write down all your symptoms. Write down when they happen in your menstrual cycle. You want to start hormonal birth control? Write down your symptoms before you start it. Write down your symptoms after you start it. And if you have problems, you go to your doctor. You have your journal there. They say, yeah, it's probably not that. You're probably misremembering. Boom. I'm not misremembering. I wrote it down. People can't gaslight you when you've got the data right in front of you, because it's very easy for people to make you second guess that your story is real. If you have written it down, you won't second guess yourself. So let's talk a minute here. Did you know that the pill depletes nutrients like folate, magnesium, selenium, B2, B6? All of those are needed for mitochondrial function, liver detoxification, hormone synthesis, and brain health. So you can understand that if you're on a medication that depletes nutrients that optimize brain function, and now you don't have those nutrients, how can you optimize brain function? We can start to see issues with that. Is the pill giving you anxiety? Because, yeah, that's real too. And I talk through how that can happen and how different deficiencies can impact your mood. Then we go through the Brighten protocol mood mastery, which is embody. That's what it's called. Embody. There's no coincidence in how we name that. Eat for your mood, move your body, banish stress, own your sleep, daily smart supplements, and your lady tribe. Your lady tribe in your community is everything to your mood. We've got to build community. And the Daily Smart supplements is because if your health is heading south quick, you're going to want to consider supplements. Supplements need to be built on a foundation of incredible nutrition and lifestyle practices. They're not enough on their own. But really, when we're in a healing phase of our life and things are going south, we definitely need to consider if supplements are right for us. So I take you through how to do all of these things, how fat can help, how you can own your sleep, the different nutrients that you can consider, like turmeric and omega-3 and passion flower and L-theanine and vitamin D, all of these things that can really help your mood. And then we go into our key takeaway section. So that's the overview of what you find in chapter 9 that take charge of your mood swings, your anxiety, and your depression. So let's open this up to some Q&A as part of our virtual book club. And let's go through, what are your questions? You read chapter 9. What did you walk away with as an aha? What struck you as like, that was super interesting. I never knew that. My jaw hit the floor. Or I'm going to do this one thing and be actionable and take these steps to take charge of my mood. So I see there's a question here. Can I fix my hormones while still taking birth control? So you can start to optimize. So while you're on hormonal birth control, this lends itself to the conversation of how does it actually work? It works by shutting down brain ovarian communication. So brain hormones are disrupted, ovarian hormones are disrupted. And that has the impact of disrupting your cortisol, disrupting your insulin, disrupting your thyroid. So you can start to work on those hormones. You cannot fix your sex hormones until you can get the brain hormones and the ovarian hormones synced up again. So as long as you're on hormonal birth control, you cannot fix your sex hormone issues, but you can start to work on the other hormonal issues that go along with that. And don't get discouraged, because that can truly help you. Your adrenal glands and your insulin are foundation to all of your hormonal health. And so while you're on hormonal birth control, Beyond the Pill will teach you how to optimize your brain health, your hormone health, and how to transition off and then get those sex hormones back on track. Rolling up my sleeves here right now because I'm like, I should have known better than to wear a sweater and then talk about this section of my book, because of course it's going to get all hot and sweaty. I'm very, very passionate about this because this was something that I actually experienced while on hormonal birth control. And I was around 19 when I found myself so depressed. Like, I was paralyzed with depression and would get in the shower and then I would just like sit on the floor. It would run cold. Like, my boyfriend at the time would have to drag me out of the shower and I would just be like crying and like a puddle. I couldn't even function. And this was weeks after starting hormonal birth control. Now, as I said at the beginning of this, at that age of 19, I was at highest risk for suicide, things we didn't know back then. I had no idea back then. But my doctor was like, nah, it's probably not your birth control, but let's just switch it anyways. And then I switched the form of contraceptive I was on, and my mood completely lifted. And nobody questioned that. Nobody questioned that, not even myself. And it wasn't until I became a physician and I started working with women that I was like, oh, snap. I'm not the only one. And how many of us feel like we're the only ones because we've never had someone in a position of authority validate what we're experiencing. Here's the news flash that we all need, and I wish I had at 19. You don't need anyone else to validate your story ever. You don't need anyone else to tell you that what you're experiencing is true. Your truth is your truth. You live in your body. You're the only one who knows what normal is. And this is something that if I could go back and tell my 20-something-year-old self I will be shaking myself being like, girl, do not look for external validation. Live your truth, step into it, and own it, because you know your body better than anyone else. Are all of these topics covered in your book? Yes. Yes. So that's what we're doing here. So I take it you're new to our virtual book club, and I want to say welcome to you. With that, we've been going through a chapter every single day. These chapter reviews, they live on YouTube right now. Like I said, my Instagram's been a little bit glitchy. I'm trying to get them all up, but we actually lost our one from yesterday. So I've got to find a way to remedy that. But it is on YouTube right now, which was the big, scary cancer, stroke, heart attack talk that we needed to have. And if I did my job right, we're not feeling afraid. It doesn't feel as scary. So your doctor said your DHEA is high. DHEA very important brain hormone. So let me just say this piece as well. When we're on hormonal birth control, because it's inflammatory, our cortisol levels can become elevated. What we understand about chronically elevated cortisol, it does destroy the hippocampus of our brain. So that, and the lack of sleep will do that as well. That's your memory center. Cortisol can start to destroy your brain if there's too much of it. We need the right amount. DHEA can be protective against that. Now, you guys, anytime I talk about these things and you're like, whoa, that's kind of scary, know that you don't need to be afraid. You need to be informed so you can make different choices so that you can live life that like really works with your body and optimizes your health. Now, is it normal after getting off of birth control to have an elevated DHEA? And is that something that should have been tested on day 3? Been using your book to heal after 10 years on birth control. Well, Alyssa, I'm so glad that you have the book. DHEA can be elevated. DHEA you can really test anywhere in the menstrual cycle because that is an adrenal hormone. It can be elevated after birth control. You want to look at something like how is it being converted? Is it going into estrogen or testosterone? It's a precursor to that. That DHEA sometimes rises because now you've got all this hormone imbalance, your cortisol is coming up. And DHEA is protecting you against that cortisol. And so that can be common of coming off of hormonal birth control. And you definitely want to investigate further. What is your body doing with the DHEA? And it comes from your adrenal glands. So get into chapter 7, where we talked about revitalize and re energize those adrenal glands and your thyroid as well. Spiritual Panda says, I just wanted to say I'm about halfway through the book, but it's so empowering. I just got off birth control 2 months ago after 11 years. I'm loving the book and your info so much. Thank you for saying that. And Spiritual Panda, I'd love to know what's been most helpful for you right now as you're halfway through the book. I see the comments. Yes, nobody's talking about this. We don't get enough information about this. Like, totally. Like, this is the thing. I got a reputation a long time ago as being the doctor who talks about the things we're not supposed to talk about. And in fact, you will hear me talk about all kinds of things with like women's sexual health and periods and things that happen that people are like, oh, that's kind of gross, or oh, that's uncomfortable, or oh, that's like, you've gone too far in the sex talk and things like that. And it's like, look, these are natural things that happen in our body. And the fact that like we have to walk around with the burden of keeping it withheld and not having permission to speak about these things and not having this open dialogue, I think that creates a strain on our health. And I think it creates undue stress that leaves us sick. And it's one of those things that's not being talked about enough is like what happens when you're experiencing something and no one gives you permission to talk about it. And sure, I can say you don't need permission to talk about these things, but depending on your social circle, it may be the case that like, you do. And one thing that we can gift every other woman with is holding space for her to really speak her truth without judgment. And that lends itself to things like when I talk about the mood chapter, I talk about healthy fats that come in. And this is where people will have their diet that they subscribe to their belief about nutrition, which is like, well, I'm a vegan, therefore I'm going to judge and hate this other person because they ate animal fat. Or I'm keto, and therefore I'm going to judge and hate on this person because they ate grains. And like it goes both ways. And I hate to break it to y'all, but there ain't no right diet. There is no one size fits all for everybody, and there's no one size fits all for life. And really, why do I use food as an example? Because that seems to be like food and politics and religion is where we decide that like we can completely separate and do an us versus them kind of scenario. That doesn't serve us. That doesn't heal us. That doesn't heal the planet. We need to be supporting each other, and we need to be recognizing that like everybody's doing the best they can with the information they have. If you want to, have someone like, be able to change their mind or get new information, we do that by having reciprocation of respect in how we hold space to be able to have that dialogue. I wouldn't know half of what I do about medicine and the world and all these things if I didn't allow myself to be vulnerable and to have my own beliefs challenged and to recognize that there are things that are beliefs and they're not rooted in science, they're not rooted in data, and that has my belief about a diet so crucial to your mood as well. How can I get rid of all the water retention in my body after coming off of birth control? So I give solutions for that in Beyond the Pill. And one thing is you got to get ovulating again. We're going to be talking about that tomorrow as we go into the libido chapter. That way you have progesterone Progesterone's a diuretic and moves it out of the body. And I also give some tips like drinking dandelion leaf tea, which is a diuretic, can help you move out that excess water. Hi there, I'm new, just ordered the book. I was wondering about copper IUD. Is it safer than hormonal birth control? It depends. We're going to talk about that in chapter 13, which is where I go through the non hormonal birth control contraceptives. So that conversation is coming up. And I see the question about birth control substitutions. We're going to be talking about that. And it's something that, like, I'm not here to tell you what to do with hormonal birth control or non hormonal birth control. I'm here to provide you with the information so that you feel empowered to make the best decision for yourself. So this lends itself into like no us versus them. I do have patients who do continue to use hormonal birth control and I support them. That's their decision. It's their body. And it's not my right to come in and be like, well, I don't believe that, like, that's what we should be doing. If their lab markers look good, they're feeling good, we roll with it and we protect them and we keep them safe in the best way we know how. And if their lab markers don't look good, then we have the real talk about like, girl, that's not working for you right now. What do I think about the menstrual cup? So Sandra, funny thing, you guys, I'm kind of old like that. It's just kind of funny because I actually used the Diva cup. I think it was about over 20 years ago that I adopted using a Diva cup. I personally use an array of things. It's just kind of like where I'm at. Sometimes I wear Thinks panties. Sometimes it's a cup. It just depends on like what's going on in my life and what feels manageable for me. And that's the real talk, is that like, it's like is working for me right now. It doesn't have to be on all or nothing. With the menstrual cups, there's a lot of really good ones out there. And when it comes to like a menstrual cup versus a like chlorine soaked tampon, it's not really like chlorine soaked, but it's processed with that. Those are halogens. So chlorine's a halogen. They can be really problematic with cellular health. So they can be problematic, and tampons can sometimes induce or introduce toxins. Pads can have the same thing going on. You can choose organic. So it's all about like what works for you. But in terms of like putting anything in your body, like a cup with what it's made from, as what we know right now currently, it's not going to be something that's like toxic to use in their body. PMS, we do talk about PMS. That was in chapter 4. Go watch the video on chapter 4, which is the take back your period. Um, I'm scrolling through, I'm looking at all your questions here and trying to stick to the take charge of your mood swings, anxiety, depression chapter of Beyond the Pill. I always been a daredevil, but when I started birth control a few years ago, I developed panic attacks and anxiety. Is it really possible to fix? Yes, I have had patients that have had similar things where they start hormonal birth control and now they're scared. They're just like unknowingly scared of everything. That is something that can be an expression of anxiety coming off of birth control and addressing the root cause. That I have had patients in my clinical experience who are able to undo that. The other thing that is interesting about hormonal birth control, and I'm putting out more information surrounding this. As I wrote the book, there were some studies around this, but not robust studies, like not a whole lot of them. And now, after I turned in the manuscript like a year ago, now all these studies are coming out, and I'm so fascinated with this, which is that hormonal birth control actually impacts. So while you're on it, you may take riskier behavior, and it might not be daredevil. It might be more of like putting yourself in a situation that, like, while your intuition would generally guide you and say, this is like a bad dude and it's very dangerous, you don't see that for what it is. And so you end up in a risky situation. You don't actually interpret the social cues in the same way. This is because structural alterations that happen in the brain. This is an area that, like, I could seriously, as I'm getting into the research, I could write a whole book on, in terms of like how we actually mother, how we interact with the opposite sex, the same sex, like how this impacts. Like, it's a question of like, yes, hormonal birth control has been instrumental in women like earning more money and graduating college and becoming CEOs. But then how does it actually impact our cognitive function? And what has this been doing long term to the female brain? These are the questions that research should be answering. It is sad to me that they introduced hormonal birth control. It started in the 1950s, then it came out, rolling out to married women in the 60s, finally getting in the hands of everybody in the 70s. And it wasn't really until we got into, the 2000s, like, and it's really like after 2010 that like people really started to question some of these brain and cognition issues. That's too long. That's too long to be medicating women without questioning it and without giving them the full informed consent. So that's what you and I are doing. We're raising awareness around all of this, and we're talking about, what it is that we need to challenge research to answer the questions on, but also holding space so women can have these conversations about what their experience is. We don't need a study to believe somebody's story. We do need a study to understand what is the mechanism of action that brought that story about. And so I really want to flesh that out, because this is something that I'll say, doctors don't need to study to believe their patients. And people will be like, I disagree. You need research for everything. And it's like, that's great. If you want to wait around for 20 to 40 years for research to catch up with the truth that patients are speaking, then be my guest. But for me, and for the way I want to be perceived, and the way I really see that we create change in women's medicine, is it starts with believing her story. It's her story. It's her journey. The data lives in there. What we need the research for is to understand why, what caused her that story to play out the way that it did. And what could we have identified before that would have changed what we prescribed and how we treated that person, so that story didn't play out and become that. Like, we don't, like, research isn't there to, validate whether or not you are truthful in what you're telling. It's to say, what is the reason? Like, and this is what we need in research. And this is science at its core. It is curiosity. It is humility. It is recognizing that we can be wrong and we can change our mind, and that we don't know everything. That is science at its core. And anybody who says, we proved it, shut it down, never question it again, they're anti-science. And they're usually the people who are like, science everything, and what you're talking about is pseudoscience. And it's like, when you start talking dogma, you are not talking science. And I say this because I love science, but I also recognize that it has its limitations, and that we're not able to actually describe and validate everything with science. And we don't have the technology. So I got asked in an interview, why is it that we're only just now talking about the microbiome, and we've only been talking about it in like the last handful of years? Because we didn't have the technology. So meanwhile, medicine was dismissing the microbiome, saying that the probiotics were quackery. Don't give probiotics. That's stupid, and that's a waste of money. And those gut bugs are just a bunch of freeloaders. That was a narrative. And then science improved its technology, and we got a reality check big time that those gut bugs do everything. So you see where I'm going with this? When somebody comes in and is like, we've proved it, book is closed, case solved, and we know everything, they really know nothing. We don't know, okay? And there's so much coming out. Like, you guys, in women's health, we were told for so long that the anatomical structure of the clitoris was this little button that sat on top of your urethra, and that was it. Medicine thinks that they have discovered so much about the female body that they can dismiss women's stories. Not all of medicine, you guys, I can be fair with that, but like, there are definitely doctors. We've experienced them. I have talked to them. I've had them as my doctors. And here's the thing, the clitoris. How long have we been dissecting human bodies? And we just discovered in the last couple of years, like, this clitoris is this giant structure. Oh, that doesn't fit that conventional narrative that like women don't really have libidos, or vaginal orgasms are impossible, or all this stuff that we get told as women. And then we find out, wow, the clitoris is like this giant, like, I mean, it's almost like it looks like something. I had a friend the other day say, like, it has legs. I'm like, yeah, it looks like an alien or a sea creature in your body. Like, how do we miss this giant thing all of these years? But that can help us be humble, right? That, wow, we just discovered this anatomical structure. But guess what? Most doctors have no idea, because that research hasn't made its way into their education. So then they're still behind in that. And can you blame them? Because they got to keep up on the next pharmaceutical and make sure they're doing right for you, and all of these things. So it's not that your doctors are bad. It's just that, like, there's so much we know and so much we don't know. And, this isn't where I thought this conversation was actually going to go today, but I feel like it was a necessary place to go, because with our mood symptoms, we get dismissed so much. And you guys are cracking up right now. I have no idea out of my mouth. This is like, real talk. My husband's been he's like, I want you to start a TV show or a talk show, because he likes to sit outside my office door and just listen to me. And then I come out and he's like in tears crying, because he's like, you're seriously, the way you talk about women's health, you're like so funny. And I'm like, I don't think I'm funny. I'm just like educating people, but you guys are cracking up right now too. And I'm like, I always am like, you're my husband, you're biased. You, of course, you think I'm funny. It works out for you. Like, the world needs more doctors like you. Thank you. But the world needs more women like you too. Women who are willing to share their truth and support other women in sharing their truth. Um, Subjects are not talked about, right? Yeah. Okay, good. I'm glad you guys are enjoying this topic. Tips for hair health. I talked about that in chapter 3 review. Go listen to the chapter 3 video. In Beyond the Pill, I actually give you a table of like, if you have this pattern of hair loss, this is the hormone that it could be. And then the labs to investigate with that, because hair loss sucks. It is like the worst. And it happens for a lot of women when they come off of hormonal birth control. In fact, I was just at the Bulletproof conference and I was getting an IV actually. And somebody came up and started talking to me. And then the hair loss conversation started. And you know how many women sat around and talked about their hair loss? A lot. And how many of them said, I like came off of hormonal birth control and I started losing my hair. I very much, so nobody's really out there talking about it because nobody wants to talk about losing their hair. Okay, I totally get that. I'm hearing more and more from women who are having hair loss, and it's starting in their early 20s. And it is something that I feel, and, I'm going to put this out there and maybe I'll be wrong, but I feel like there's something in our environment, some environmental toxicity that is affecting women in a way we may not even know what the chemical is. We don't have the research yet and we just have no idea. But more and more women are suffering from hair loss is what I'm seeing. Now, this is anecdotal and this is my clinical experience. I have to go dig in research to see if that's actually validated in the science. But understand the limitation of that science would be, is a woman confident enough to go to her doctor and talk about her hair loss? Because if she's not, then we actually don't record that. We don't have that statistic. So, so infrared sauna for people trying to conceive, and egg donation. Bring your questions tomorrow. We're going to talk about fertility and libido. Beyond the Pill does not go in depth about egg donation and egg harvesting and all of that. If you are an egg donor, firstly, mad respect to you. That is such a gift. Secondly, you're going to get hit with a lot of hormones. You need the protocols and Beyond the Pill to help you through that. Same with IVF. But we'll talk more about that. But I always like to be really honest and forthcoming about what you'll find in Beyond the Pill and what you won't. And you won't find information about, you won't find in-depth protocols about egg donation and IVF, but we are going to talk more about that tomorrow and what you will find in that chapter. But I do want you to know that anytime you're using exogenous artificial hormones, take a look at Beyond the Pill. And that includes bioidentical hormones, especially when you get into the liver chapter and estrogen metabolism. You'll understand that if you're on bioidenticals, you want to be supporting your body and how you process it. What is the least evil birth control? Okay. I've not done my job if anybody thinks birth control is evil. Okay. I don't want you to think that birth control is evil. It's an instrument and it's a tool. And really the conversation is, what is your family history? What is your history? What are your genetic markers? What is your lifestyle and dietary practices? And what is the best choice for you? What is your primary reason for using it? And what's the best choice for you? Just like diet, there's no one size fits all with contraceptives. And it's an individualized discussion and choice, because it's so much more than just like, oh, the pill is good or bad. There's a time and a place for all of these things. I don't think I'd be a doctor if it wasn't for the pill. It was a tool I used to become a first generation college student and control my fertility and ditch period problems. That part was a little bit nice, but it was also a little bit like, wah, wah. If I knew then what I know now, right? So I just want to be clear. We're not vilifying contraceptives in any way. We're trying to just have open dialogues and conversations. In Beyond the Pill, I take you through all the side effects. Chapter 13 takes you through alternatives to that as well. Wow, so many questions coming through. You guys, I love your questions. You are seriously some of the smartest people I've ever encountered. Your questions are just so good. You talk to at least 10 pregnant women a day, and at least one person has hypothyroid or PCOS. It's not normal. It is so true. And what is so sad is PCOS and hypothyroidism can put you at an increased risk of infertility and miscarriages. We're going to talk about miscarriages, but definitely if you are a woman with hypothyroidism or PCOS, you want to grab Beyond the Pill, because I've got a ton of protocols in there to root cause all of that business, to optimize your health and to not have to have similar struggles. I personally had a miscarriage because my hypothyroidism was mismanaged and that I wasn't medicated properly as soon as I became pregnant. That's why I wrote my first book. That's why I did a lot of advocacy around thyroid health, fertility, and postpartum thyroiditis because I saw it in my patients. And then I personally went through the heartbreaking, like, I can't even tell you, like, medical school does not teach you like what it's like to have a miscarriage. And I will tell you, there is no freaking words in this world that could comfort a woman who's going through it. So as many as we can prevent, like, that's really where it's at. But we also have to hold space to the body having a wisdom that if that baby was not compatible with life, that means not viable, and the outcome would have been bad for that baby. Sometimes our bodies choose to terminate. So I say that piece because and I've been there. When we have miscarriages, we turn that finger back on ourselves and we point at ourselves and we beat ourselves up and we talk about everything we've done wrong to ourselves. And it is hard enough to lose a baby that you wanted in your body and that you so wanted to hold in your arms, but then to feel shame, guilt, feel like you can't talk about it, and to feel like you did everything wrong, that's too much for somebody to handle. So if you are a woman who personally experienced a miscarriage, sharing your story, I know it hurts and it's painful, but you never know who will read your story and heal from that. And when I share, it was very hard. The first time I shared my miscarriage story, I think I probably cried like 6 hours that day because it was like rehashing it, reliving it. But I realized that, like, with everything that I've been through, there's an opportunity when I share my story to help somebody else resonate with that and heal. And it's been the same as my son struggles with a chronic autoimmune condition known as PANDAS, pediatric autoimmune neuro disorder. And with that, I didn't want to talk about it and I didn't want to share it, but we realized as a family that we had opportunity to help other families heal. And so sharing your story can be so, so powerful. You guys, we are going like all over the place today in terms of our conversations here. And I just want to say I'm really actually digging it and enjoying it right now. So thank you for your questions. You have high thyroid antibodies after the pill and your ferritin is very low. Does this automatically mean that I have autoimmune disease, or could I reverse this? Yes, the diagnosis. So this is great to flesh out. If we see elevated antibodies, that is, it's like, and through, they've got to be a certain point of the reference range. That is a diagnosis of autoimmune disease. It doesn't mean that. So autoimmune disease, as we talked about, please go back and listen to the gut check chapter where we talk a lot about autoimmune disease, and then the thyroid chapter as well, which we just talked about 2 days ago. With that, we first see antibodies and then we see symptoms and then we see complete tissue destruction. Like, that's the evolution of autoimmunity. So if it starts with antibodies and we have no symptoms, oh yeah, you can reverse that. And if you do have symptoms, you can still reverse that. And if you have structural changes like tissue damage, you can still reverse the autoimmunity, but you may need like a medication or something else. Like with thyroid disease, if you destroy enough of your thyroid, you need a medication to replace the function of the tissue that you've lost, because you can't live without thyroid. It's a non-negotiable. So with that, in Beyond the Pill, I actually walk you through how to reverse autoimmunity. It's been one of the big things where women are like, whoa, I bought this book because I had a history of birth control, but I had no idea I would actually be learning how to manage my hypothyroidism and my autoimmune disease. And I'm like, yep, because that's a women's health issue. And this is a women's health book that actually happens to span the whole gamut, unlike many women's health books that are not talking about hormonal birth control. I had to bring that as part of the conversation as well. So I see you guys coming in and supporting each other. You guys are so awesome in doing that. Is autoimmune disease connected to your diet? It can definitely be if you're eating. So there are certain proteins that can cross react and cause you to attack your tissues and can make your immune system get all hot and bothered so that it does attack your tissues. You just left your gynecologist's office where she stopped short of calling me crazy for thinking my IUD had caused issues. That's sad to me. That's sad to me that a woman is already like writing off and dismissing women. There's a well documented medical gender bias where just by having female on your chart, your doctor is walking into the room already thinking that what you're telling is maybe not true. And thankfully, medical schools are recognizing this. They're changing the curriculum because that bias isn't something doctors had. It's something that was taught and brought into their medical education. So, I'm sorry that you had that experience. It's time to get a second opinion, and talk to someone else. And that's actually how I got into this work. The very first patient where it really struck me was an IUD patient. And I got the reputation, patients would call my office and say, I hear you're the doctor who believes women's birth control. And then they told her that she had PMDD, she had to be on all these psych meds. And she came to me. And when she went through was, and she's like, I think it's the IUD. And I'm like, well, why don't we remove the IUD? Like, why don't we think about doing that? And I had been working with her to try to heal her mood. It just didn't work. She got the IUD out and she said what so many women have said. I like woke up the next day and I felt like myself. It was like this cloud lifted. I have an IUD story on my YouTube of a woman I interviewed who had the same experience with that. So, track your symptoms, track your data. And when you go to the next doctor, have that data. Like when you have it written down, it is something that it's something that can get your doctor to listen, especially when it's quantitative. Will I make a story of all the food I eat in a day? You should definitely follow my stories because I do that sometimes. And it just depends. Like today, I actually got up. I could had no time to document breakfast because my son was having really extreme stomach aches, and I actually spent an hour just holding my son, rubbing his belly and comforting him. So I do make that happen quite a bit, but I'm happy to do that. It was, it always shocks me you guys actually care what I put in my mouth. And then I'm like, well, kind of makes sense, right? You never knew those terms before the book and never thought that I would be able to expose so much risk in using the NuvaRing for so many years. I'm not sure what terms we're talking about, but I appreciate your comment. Just the same. Um, which is the test we can have to determine destruction of antibodies as a result of antibodies of the thyroid. TSH, free T4, free T3, reverse T3. You want to look at all of that and what is going on. And I talk all about that in the thyroid chapter of Beyond the Pill. And if you go back to 2 days ago, there's videos there for you that you can watch. I go through that chapter review and we have a discussion about that. You had a friend who had her thyroid removed and developed lupus. Can that be reversed? Yeah, lupus can be reversed. I've worked with lots of patients who have been able to reverse it. Any autoimmune disease can be like autoantibodies can be reversed and put into remission. The tissue destruction, that's a different story. Like if you have rheumatoid arthritis and you ate away at your bones with your immune system, you can't just get your bones back like overnight. There are some people who are like, yeah, you can actually remineralize and rebuild bones, but once the fingers actually get deformed in that condition, like there's no coming back from that. With something like MS, so multiple sclerosis, even though you have destruction of the myelin sheath, there is a way of coming back to that. Go see my dear friend, Dr. Terry Walls, who was in a wheelchair due to MS and reversed it using natural therapies. It is possible. She now walks. She now actually kicks ass. Go follow her. I'm always like super impressed. She's like, I'm in my pool. I'm doing swimming. I'm doing this. I'm doing that. I'm like, dang, girl, you are like, man, she's such inspiration. Um, would I collaborate with some recipe bloggers, to make a cookbook? Yeah, I totally would. I actually have, I had friends who were pointing out that they're like, you have more than enough recipes to make like a cookbook. You're just terrible at writing them down. They actually all go in like my Instagram stories. You'd love to see a photo of your homegrown food space. Definitely, I will do that. If you hang with me, especially as it warms up, you will be in my garden. All of my stories end up being done in the garden. I just did a post the other day showing like everything that I planted. Oh, that reminds me, I got to go out and take care of my peas and make sure they're going up the trellis right. But why do we want to try or grow our own food and what's important about that? Well, you get the soil microbes and that actually can help your gut health. Even if you don't have garden space like I do, you can grow in a pot on your window, like arugula, super easy. Herbs are super easy. You can also sprout your own broccoli sprouts. There's ways like really like the biggest like act of resistance is to grow your own food in the current scene that is our food supply. Who's your wheelchair friend again? Dr. Terry Walls. Yeah, and somebody posted it right below there so that you can see that. All right, guys. So I firstly want to say thank you so much for your support of Beyond the Pill, which, by the way, for people asking about recipes, if you go to beyondthepillbook.com, you can download there's bonus recipes. So the book gives you recipes and a meal plan. Yes, vertical gardening is good as well. And then when you get those book bonuses, you also will get more recipes as well. As you guys know, my background is nutritional biochemist and clinical nutritionist. And so with that, I'm very big on food is medicine. So definitely grab those bonuses. Thank you. I've seen all the Amazon's reviews coming through in the last couple days. You guys are awesome. I love it. And then I had some more women write me and they're like, oh, I read this review and I just bought Beyond the Pill. Like, you guys are seriously change makers, like next level change makers. And I want to honor you and all of this because I wrote the book, but I alone can't change women's medicine or change women's lives. That's really you who is out there being the living proof of what is possible and sharing this information, this knowledge. So if you can, tag a friend, forward this on to somebody, share this. I'd be super, super grateful because we need to get the word out that we are not crazy. Things are not in our head. What we experience is real, and there's a whole lot that we can do about it.